Hello, welcome everybody. We'll get started with our session today. Today's topic is all about exercise and living with diabetes as well. My name is Renee and I'm one of the staff members here at the UHN Cardiac Rehab program. And I will be doing today's talk. A couple of ground rules before we get started. These sessions are for education only. Ask your healthcare provider for specific advice about your own situation. And during the session today, if any questions come up, you can feel free to use the Q&A button on your Zoom toolbar and you can type in your questions there. So by the end of today's session, I'm going to go through the different parts of a balanced exercise program. I'll talk about the benefits of aerobic exercise and how to stay safe with exercise, and then a few resources for exercise, including some action planning to get you started. So a balanced exercise program has a couple of components to it. The first part would be aerobic exercise. And so aerobic exercise refers to any activity where you would warm up for a couple of minutes, get to a particular heart rate or a level of intensity, moderate intensity, and keep it there for at least 10 minutes. And then after that, you would cool down. And that's the type of exercise that helps to improve your cardiovascular fitness. And then there's resistance training. So this can include lifting light weights or using stretchy resistance therabands as well. And resistance training is good for strengthening your muscles as well as keeping your joints strong and your bones strong. And resistance training in combination with aerobic training can also help to improve your cardiovascular fitness. Resistance training also does a really great job of managing your blood sugar. And that's because whenever you have sugar that's running through your blood after you eat a meal, every time that you move a muscle, so let's say you're doing a bicep curl, that muscle uses up that sugar that's in your blood for energy. And so that's how resistance training helps to manage your blood sugar throughout the day. And it doesn't only help during the moment of the exercise, but even for hours after completing an exercise. So very much recommended if you are living with diabetes. There's also stretching that you can do with a balanced exercise program. And this can be done ideally at the end of of an aerobic session or a resistance training session when your muscles are warm and more flexible. Then that's a good time to incorporate some stretching. And then there's also daily movement. Daily movement is really important. And that just refers to your day-to-day activities, things you do around the house, maybe at, getting up and walking to the kitchen and back, or especially if you're sitting in a desk job all day long, making sure to break up that sitting time and have some moments where you're getting up just to do maybe a little stretch, or parking at the back of a parking lot and walking a little bit further into the store, taking the stairs when you're able to. All those little bits of daily movement really add up throughout the day. And we know through research that this has been shown to help to prevent heart disease, stroke, diabetes, and even certain types of cancer. So very important to break up your sitting time throughout the day. Okay, so we're going to, I'll play a video from our Thrive program that is specific to those living with diabetes and starting an exercise program, and then I'll continue on after this. So I'm now on the Cardiac College website and within the Thrive, the Diabetes College website. This is our sister website on the within the Thrive program, where there are the 12 modules that you can take a look at any time. There we go. Aerobic exercise. We'll play this one.
Has your doctor told you that you need to exercise? If you're wondering how to get started, you're not alone. You might be asking yourself questions like, what type of exercise should I do? And how can I fit exercise into my already busy schedule? Research tells us that most people living with diabetes can exercise safely and lower their blood sugar. In fact, regular exercise can be as powerful at lowering your blood sugar as any diabetes medicine. Managing your blood sugar with regular exercise will help prevent a heart attack or stroke. This weekly challenge will coach you through starting an aerobic exercise program. What is aerobic exercise? It's the kind of exercise that raises your breathing rate and heart rate for at least 10 minutes. Some examples include walking, biking, jogging, and swimming. Aerobic exercise is sometimes called cardio. It can be overwhelming to start an aerobic exercise program. There is a huge amount of information available on the internet, but unfortunately, much of this information is not designed for a person living with diabetes. Diabetes exercise programs in your community are a great way to get the support you need. These programs can give you a safe and effective exercise program to follow. Joining a diabetes exercise program will give you support and motivation to get started with regular exercise. Research says that doing aerobic exercise for at least 30 minutes most days of the week will give you the most benefit. You can even divide the 30 minutes into 3 10-minute bouts of activity. Since exercise can lower your blood sugar, it is important to exercise most days of the week. Once your doctor says it's safe for you to start an exercise program, think about how you will establish the habit of regular exercise. Look at your calendar right now and see how you can schedule 10 minutes of exercise on 3 to 5 separate days. Now, decide what type of exercise you will do. Walking is the most effective type of exercise and costs the least amount of money. All you need is a good pair of shoes. Next, plan where you will exercise. Find a flat route if you are exercising outside. Think about where you will exercise indoors if it's too cold or too hot outside. You may consider joining an exercise facility or buying some home exercise equipment. Ask your doctor or diabetes exercise team how hard you should work during your exercise sessions. Most people can exercise at a level that feels like somewhat hard work. At this level, you will breathe faster and deeper. Your heart will beat faster, and you may start to sweat. When you have diabetes, you have two unique things to consider when you start an aerobic exercise program: neuropathy and low blood sugar. Neuropathy is a health problem people living with diabetes can develop. It is a tingling, pain, or numbness in your hands or feet. If you have numbness, you are at risk for skin injury on your feet. It is important that you check your feet for blisters and sores every day. Talk to your doctor if you have a blister or sore that does not go away. The second issue to consider when you start an aerobic exercise program is the danger of hypoglycemia, or blood sugar that is too low after exercise. You are likely to get hypoglycemia after exercise if you take insulin or another type of diabetes medicine that causes low blood sugar, like a secretagogue medicine. Ask your doctor or pharmacist if you are taking one of these medicines. If you are more likely to get low blood sugar, check your blood sugar before you exercise to make sure it's high enough. You may need a snack before you start exercise. Check your blood sugar again after you exercise. Carry a fast-acting carbohydrate snack like sugar tablets or juice with you at all times. If you get low blood sugar, treat it right away. When you get used to exercising for 10 minutes on 5 separate days each week, the next step is to add extra minutes to your exercise time. Slowly increase your time to 30 minutes each day. Remember, you can divide your exercise time into short 10-minute bouts. As you become more fit, you may notice you have more energy or your mood improving. You might find your daily activities become easier to complete. You also lower the chance that you will have a heart event and lower the chance of getting certain types of cancer. Talk to your doctor or exercise team about your goals and what becoming more fit means to you. Remember, a small change to exercise more is a big step closer to better health.
And you can type any questions into the chat box if you have any questions about that video. Otherwise, there was a couple of benefits listed there, benefits of exercise and all the good things that it can do for your body, as well as a few important safety tips there for those specifically living with diabetes. So for example, really being mindful of your foot care and making sure to watch your feet, since you might be prone to having lowered sensation in your feet and may not feel if you get a blister or a hangnail in your toenail. So making sure to always to keep a good eye on your feet and keep checking to make sure that you don't have any sores that are developing. And then as well, being mindful that exercise will most likely bring your blood sugar down. So just being aware of what your blood sugar is before you start. And you might want to check your blood sugar right before, right after for the first few sessions of exercise, if that's new to you, to get an idea of how your body responds. All right, so the aerobic exercise, which can be walking, cycling, swimming, this is any of that continued exercise, continued movement for at least 10 minutes. So the recommendation is to do this for 5 days each week, working up to 30 minutes at a moderate intensity. So as the video mentioned, this could be small bouts of 10 minutes of exercise throughout the day, and then you could work up to getting a full 30 minutes in over time. Resistance training with using TheraBands or free weights. This is recommended to complete 2 to 3 days a week. And because I mentioned with diabetes, the great benefits that resistance training can do to help lower your blood sugar. If you really enjoy resistance training, even doing this every other day is great to do just a little bit of movement, at least some, during the day, especially if, during COVID right now, if you are at home a lot, you can't get out to a gym or a community center, or the cold weather, you can't get outside for a walk. Even focusing on resistance training a little more often during those times is a good idea. And then in terms of reducing our sitting time, so we want to sit less and move more, and this is your day-to-day activities that you might do around the house, and hopefully post-COVID we can get out and do more things. So the recommendation is to get up and move just for about 2 minutes, but to do this a couple of times each hour. And so sometimes if you're working at a desk job and you're sitting all day, some people like to set an alarm on their smartphone, and this just helps to remind you to get up throughout the day, just for the purpose of moving and getting the blood flowing. Otherwise, you might find that you end up stuck sitting down at a desk for 3-4 hours at a time. So in the beginning, it's nice to have those reminders to break up that habit. For the stretching, this is an example of the stretching exercises that we do here on our rehab program. And we've broken them up into dynamic stretches and static stretches. So dynamic stretches is more like dynamic meaning moving. So it's more of an active warm-up, standing march, some shoulder rolls, leg swing, ankle rolls. Again, just gets some movement into your joints, gets the blood flowing to get you ready for exercise. And then after exercise, we recommend these types of static stretches. So these are not moving. So you would hold these positions really still for about 15 to 30 seconds, taking nice deep breaths throughout, and that helps the muscles to relax a little bit more. And these are better done at the end of exercise when your muscles are warm. All right, so some important things to keep in mind to stay safe with exercise. So really important for everyone to follow their individualized prescribed exercise. And so if you're part of a rehab program, listening to your exercise team or your doctor to learn about the exact intensity that is appropriate for you. So how fast to walk, maybe you might have a target heart rate that you're aiming for, and trying to stick within that intensity that's been advised for you. And then reporting to your care team if you have any problems at all. So any symptoms that might come up, any discomfort, shortness of breath, dizziness, any aches or pains that you have in your muscles or joints, or maybe a sore on your foot, like we mentioned. I'll make sure that you bring these up with your team so that they can advise you on how to adjust your exercise. Okay, preventing and treating a low blood sugar. So if you know that you are prone to having low blood sugar, and remember that's usually those who are using insulin or other oral insulin secretagogue medicines. Common ones are glyburide or glyclazide. Those ones you are more prone to having a low blood sugar. So be aware of that. Remember that exercise also brings your blood sugar down. And so that's to make sure that you are starting off at a good level of blood sugar, ideally above 5.6, before you go and do a session of exercise, so that you've got the energy to carry you through that exercise session. And that if you do ever experience a low blood sugar during exercise, so a blood sugar under 4, and that might bring on symptoms for you, such as shaking or sweating or feeling a little bit of confusion, or you might feel clammy, whatever your usual symptoms are for low blood sugar, be aware of that. And so that's why it's important to carry fast acting sugar with you. So glucose tabs or juice, have that right with you so that if you do feel unwell, check your blood sugar. And if you've confirmed that you're less than 4, go ahead and treat your blood sugar with the juice or the glucose tabs. Be mindful of the weather outside if you plan to exercise outdoors. So in the winter, cold, wet weather, our guidelines are usually anything colder than minus 10 degrees Celsius with the wind chill is probably too cold to try and do your exercise prescription in that weather. So that means trying to stick to your usual intensity. Your body just has to work a lot harder to keep yourself warm as well as perform the exercise. And so anything colder than that, find an indoor place or maybe skip that day for exercise. Otherwise, you can layer up, dress warm, and then you can probably still get a couple of outdoor days of exercise throughout the winter. And as well in the summertime, if we have really hot, humid weather, that can make your exercise feel more difficult. So just be aware of that. And you might find that your blood sugar tends to respond by really high, really low blood sugar when we have an extreme weather change. If we all of a sudden have a very hot, humid day, you might notice that your blood sugar responds differently on those days. So just something to be mindful of if you are planning to exercise then. And protect your feet. So, you're prone to having any, blisters, sores on your feet, just, anyone is from exercising, or if your foot is rubbing on your shoe. But remember, with diabetes, you might not feel a blister the same way if you have decreased sensation in your feet. So that means you'll have to keep an eye on your feet and check your feet regularly to make sure that everything looks okay. And then let your exercise team know if you have any other problems with your eyes, your kidneys, or your heart. So these are common complications that can come along with diabetes. So let your team know so that they can adjust your exercise program. All right, so some resources to help you. Our program patient education website is diabetescollege.ca. And this is where you can find lots of information about treating diabetes, information on getting active, eating healthy, feeling well, and taking control and self-management, as well the Thrive program, which is one of the videos that we just watched today. Lots of different topics that you can browse through there to learn about by watching the video, and then it can take you through an action plan process. So this is within the Thrive program as an example. When you click on the plan button, it will walk you through the process of setting up goals and action plans for yourself. I'll just go back. So as an example, for starting an aerobic exercise program, you might want to just take a minute to think after watching this video, is there something new that you can try this week? Just a small action, a small behavior that can help you to become more active. And so that might mean, this week I plan to walk for 10 minutes during my lunch breaks. Or this week I plan to purchase some free weights to try and do some exercises at home. Or this week I will make a plan with my partner to go for a walk on Saturday morning around the house. So getting very specific with your action plan, and it helps to write it down. It makes a difference. Get a pen and paper, write down your plan for the week. Maybe plan out, look at a calendar and plan the days when you want to try and do some walking, especially if this is a new habit for you. That's a good thing to try in the beginning, just until you get a good routine going. And then it becomes, after a while, it starts to become your normal routine to include activity into your day. All right, so what we covered today are the different parts of a balanced exercise program, benefits of exercise and how to stay safe. And then don't forget about action planning. That's always a great place to go back to if you're finding that your motivation is feeling low, especially during the winter time. Plus, we're all dealing with COVID right now and needing to stay home. So come back to action planning. Think what's one small behavior, one new thing that you can try this week that can help to get you moving a little bit more. So if there are any questions, you can go ahead and type them into the Q&A box, and we'll see them there. And otherwise, I'll move my slides along here. So this is a reminder that Health E University, which is your one-stop shop for all of our patient education material, is now on Twitter. So you can follow us on Twitter to get all of the latest updates. And I want to thank you all for joining us for this session, and a reminder that the next live session will be on Monday, March 1st, 10 a.m., talking all about heart rhythms. Thanks for joining. Enjoy your day.